Hello, everyone. I'm Dave Hashey. I'm a professor and a pharmacist with the Department of Family Medicine at Idaho State University. And in this module, we're going to be talking about HIV, hepatitis, and STDs. But as part of that, we're going to start just by reviewing and introducing different online resources to assist you navigating these units. I have no financial conflicts within this section. But I have authored a part of the HIV National Curriculum. The objectives for you to process and navigate through this unit are first just to list some of the different online educational resources for HIV, hepatitis, and STDs. It's important to be able to not only identify these resources, but to utilize them in a way that is effective for you as either a public health official, a student, or a practitioner. Also, in addition to accessing, we're going to look at touring different online resources and reviewing and navigating different areas and reviewing different features. And most of these will be done by you outside of this recording. Let's start with HIV. What's important about understanding these online resources for different diseases that we'll be talking about is the quality of the resource, of the website, of the application. And the reason why this is important is because there are some websites that are not validated, they are not reviewed, they are not high quality. And so the resources and the websites I am going to introduce are websites that you can go to as a public health official, a student, a provider, and feel comfortable about the quality and integrity of the material that you're resourcing. The first one in regards to some of this general information on HIV is the CDC. The Centers of Disease Control have a very well vetted, referenced, and easy to navigate website. Through this website, what is easy about navigating it is searching by disease state. Within the disease state, they have information for patients, providers, healthcare professionals, and other individuals. There's also a very interactive website called AIDSview, and this website will help you navigate some of the country information, some of the state information, and even down to your regional information on HIV epidemiology. And we'll look at this a little bit in some of the other units. We're looking for other general information about disease prevalence or incidence. You may be in a situation where you're looking at starting a program, or you're looking at building the capacity of some of your HIV programs for patients. And HRSA, or the Health Resources and Services Administration, is another governmental website that will provide resources for you on how to build potential programs, access grants, and it's a fantastic website to build that. For example, if you were looking at a way to increase testing for patients who inject drugs, there will be spots within this website where you can go where other programs have done this, look at best practices so that you don't need to reinvent the wheel. HIV.gov is another excellent website to access information on drug information, on guidelines, which gets me to the last one on treatment guidelines. This one is probably geared more towards healthcare providers, where if you're questioning information of how do I test for HIV, what drugs do I use to treat HIV, how do I monitor for HIV, the treatment guidelines are going to have all those answers. It's a rather large document and website to navigate through and can be fairly clunky. So you may want to spend some time really navigating that if you're a provider who will be using the resources for treatment of HIV. And really one resource that brings all of this together is the HIV National Curriculum. This is a really strong self-directed learning resource and website. It was created by the University of Washington in support with funding through HRSA. And the beauty of this website is that it has all this information that is digestible and really user-friendly to navigate. So I strongly encourage, whether you're a student, a provider, or a healthcare professional or public health professional, to really go through this and spend some time with this. This is a really sort of one-stop shop. In addition to updated information, you can also get credit, continuing education credit. There are test questions and question banks there. So it really builds competency for individuals that want to take a self-directed, stepwise approach to understanding the full spectrum of HIV. Next up is hepatitis. And very similar to HIV, without going over everything again, the CDC is a very strong resource, followed by hepatitis C guidelines for individuals who may be treating HIV. And if you're working with patients with hepatitis, the Hepatitis Education Project, or hep.org, is a fantastic resource to provide to patients, as there are individual resources for support groups, for harm reduction, and utilizing that and providing that for patients is fantastic. And then similar to the HIV National Curriculum, the University of Washington also has courses online for hepatitis C and hepatitis B that help provide specific information on whether it's just testing or treatment, and it can be self-directed. You can access this for continuing education credit. So another really strong self-directed learning platform. And then the last few resources I wanted to provide you are those on sexually transmitted diseases. Not to sound like a broken record, but again, the CDC is a fantastic resource, followed by the National Institutes of Health and the STD Wizard, which can help you as a clinician to really navigate some of the complexities of screening and treatment. And then, again, the University of Washington has replicated that platform off of the HIV national curriculum, in which providers can go in and look at specific STDs, learn about screening, epidemiology, treatment, partner resources. And again, as public health officials, learners, this is another great resource. And specific to Idaho and those individuals practicing in Idaho or outside of Idaho, going to your state's health and welfare website is usually a good resource to start with understanding your state's basic epidemiology, your state's laws on disease reporting, case reporting, as well as resources for patients. This is usually a good portal where you can identify and find whether it's treatment locators, places to screen for certain diseases, syringe exchange or harm reduction. And so Idaho's Department of Health and Welfare is a good portal to start with that will help you navigate these resources. There are also testing and treatment locators where you can go to these websites, put in a zip code, put in a state, and it will help you identify a clinic or a health department where your patients can go to safely be screened or treated for some of these conditions where there may be stigma or limited resources. And one of the questions I think we should ask at this point is, why are these websites relevant? And the major reason why they're relevant, and the major ones that I've presented to you, is that they're well referenced, vetted, and updated. You want to go to a website that has the latest information, that's not outdated, that's not filled with misinformation or incorrect information. And the other reason too is we cannot remember all the information that is available on every condition. In these conditions, specifically HIV, hepatitis, and STDs, research, treatment guidelines are all being updated on a regular basis. And knowing where to go to get that latest information is critical. And so really why these are relevant is not to be able to remember everything all the time, but to be able to know where to go to get the information when it's needed. The other thing too is we're going to be using these as examples in the other units in this module, as well as potentially some other modules. And a lot of the images, graphics, resources I pull come from the national curriculums. Again, they are open resources. They are funded by the federal government, and therefore they are open resource. And again, navigating these in your regular practice are going to be important, partly because you're going to, at times, need to have a quick information. Where do I go to understand more on HIV or chlamydia or gonorrhea? And having this at your fingertips, whether it's bookmarked within your web browser, whether it's an app on your smartphone or your tablet, you can access a lot of these in various settings to help support you in decisions, whether it's for a patient, it's building your own education, or how you're navigating. So bringing this all together, hopefully at this point you now are able to list different online educational resources for HIV, hepatitis, and STD, looking at well-referenced, resourced websites. And also that you're taking the time to access and tour and navigate these areas and find things that are important to you, whether you're a public health official or a student or a healthcare provider. What's relevant for you? Should you need to register for some of these websites to be able to, again, get information sent to you or get continuing education? These resources are all extremely valuable. So again, thank you, and we'll be navigating more of this in the future units.